swallow once, just once. Now notice what you feel at the back of your throat. Is there a thick coating sitting there? A sticky feeling. A lump of mucus that will not clear no matter how many times you cough, sip water, or clear your throat? If you are over 60, this may have become so normal that you barely think about it anymore. Maybe it started only in the morning, then it stayed until lunchtime. Then it began showing up after meals, during conversations, while lying in bed, or every time you tried to speak. You may carry water everywhere. You may keep throat lozenges nearby. You may avoid milk, spicy food, cold drinks, or anything someone once told you could make mucus worse. And still, the problem keeps coming back. I am Dr. James Walker, and I want you to understand something important. Constant mucus in the throat is not random. Your body does not keep making you clear your throat for no reason. That mucus is usually a signal. The problem is that many people treat the mucus itself, but never ask why the body is making it or why it is not clearing properly. They drink more water for a few days, they take cough syrup, they buy allergy pills, they try honey, lemon, steam, ginger, or whatever a neighbor suggested. Some of these may soothe the throat for a while, but if the real cause is still there, the mucus comes back. Today, I want to explain 5 common reasons older adults keep feeling mucus in the throat, and more importantly, I want to explain why 2 or 3 of these causes often happen together, making the problem feel worse than it should. Before we go further, let me make one thing clear. Mucus itself is not bad. Your body makes mucus every day. It protects your airways. It catches dust, germs, smoke, pollen, and irritants before they move deeper into your lungs. It keeps the throat moist. It helps protect delicate tissue. So the goal is not to have no mucus. The goal is to stop the mucus from becoming thick, sticky, excessive, and stuck. As we age, the body's mucus clearing system can slow down. Inside your nose, throat, and airways are tiny hair-like structures that help sweep mucus along. Think of them like little brushes moving mucus out of the way all day long. When you are younger, that system often works quickly. But after 60, it may not work as strongly. The mucus may move more slowly, it may sit longer, it may feel thicker, and if anything causes extra mucus, you notice it more. This is why a small irritation that a younger person barely notices can become an all-day throat problem for an older adult. Now, let us talk about the first cause: silent reflux. This is one of the most missed causes of constant throat mucus. Most people know acid reflux as heartburn, burning in the chest, sour taste, pain after a heavy meal. But silent reflux can happen without heartburn. That is what makes it so confusing. With silent reflux, small amounts of stomach acid or digestive fluid travel upward, sometimes all the way to the throat or voice box. The throat is not built to handle acid, so even a small amount can irritate the tissue. And when the throat gets irritated, the body tries to protect it by making more mucus. That is why a person can wake up every morning with mucus, throat clearing, a rough voice, or a feeling that something is stuck, without ever feeling chest burning. The stomach was involved, but the symptom showed up in the throat. This often gets worse at night because lying down makes it easier for reflux to move upward. Eating late makes it worse. Large meals make it worse. Spicy food, fried food, chocolate, peppermint, alcohol, and coffee can make it worse for some people. Now, ask yourself this: is your mucus worse first thing in the morning? Does your voice sound rough when you wake up? Do you clear your throat after meals? Does it get worse when you lie down or bend forward? If yes, silent reflux may be part of the problem. The first step is simple. Stop eating at least 3 hours before lying down, not 30 minutes, not 1 hour. Give your stomach time to empty. Also, avoid very large dinners. A heavy meal late in the evening is one of the easiest ways to trigger overnight throat irritation. And do not just stack extra pillows under your head. That often bends the neck and can make things uncomfortable. If reflux is a problem, raising the head of the bed slightly or using a proper wedge may help more. Now, the second cause is post-nasal drip. This means mucus is draining from the nose or sinuses down the back of the throat. Many people think sinus problems always come with a blocked nose, facial pressure, or a headache. But that is not always true. You can have mild chronic sinus inflammation and still breathe mostly fine. The sinuses may produce extra mucus quietly. That mucus runs backward instead of out the nose. It drips into the throat, where it causes clearing, coughing, swallowing, and that sticky feeling that never seems to leave. This is very common after midlife. The inside of the nose can become more sensitive. Allergies can change. Dry air can irritate the lining. Dust, mold, perfume, smoke, and pollution can all play a role. And here is where many people make a mistake. They take antihistamines for months because they assume it is allergy. Sometimes antihistamines help, but sometimes they dry the mucus too much, making it thicker and harder to clear. Dry, sticky mucus can feel worse than thin mucus. A better first step for many people is a saline rinse. A gentle saline rinse helps wash out mucus, dust, pollen, and irritants. It also helps the nasal lining stay moist, but it must be done safely. Use distilled water, sterile water, or water that has been boiled and cooled. Do not use plain tap water straight from the sink. Use a clean rinse bottle or neti pot. Follow the instructions. Use the right salt packet or saline mix. And be consistent. Doing it once and saying it did not work is not enough. For many people, daily use for 1 or 2 weeks gives a clearer answer. Now here is what we have learned so far. Morning mucus may point toward silent reflux. All-day dripping or constant swallowing may point toward postnasal drip. But many seniors have both. Reflux irritates the throat from below. Postnasal drip irritates the throat from above, and the throat is stuck in the middle, trying to protect itself by making more mucus. That is why the problem can feel so stubborn. The third cause is medication. This one surprises people because they do not expect a prescription to be connected to throat clearing. One common example is a group of blood pressure medicines called ACE inhibitors. These medicines can be very useful. They help many people control blood pressure and protect the heart and kidneys, but in some people, they can cause a dry cough, throat tickle, or constant irritation. The confusing part is that this side effect may not start right away. It can begin weeks or even months after starting the medicine. So a person may not connect the two. They may say, "I started that blood pressure pill months ago. This throat problem is recent. It cannot be related." But it can be. The throat may feel irritated. You may cough without being sick. You may keep clearing your throat because it feels like something is there. This does not mean you should stop your medicine. Never stop blood pressure medication on your own. But if your throat symptoms began after starting or changing a medication, write down the timing and bring it to your doctor or pharmacist. Ask, "Could any of my medicines be causing throat irritation or cough?" That one question can save months of frustration. Sometimes there are other medication options that control blood pressure without causing the same throat problem. But that decision must be made with your doctor. The fourth cause is dehydration. I know that sounds too simple, but stay with me. Mucus is mostly water. When your body is well hydrated, mucus tends to stay thinner and easier to move. When you are even mildly dehydrated, mucus can become thicker, stickier, and harder to clear. Think of syrup. When it is thin and warm, it pours easily. When it thickens, it sticks to everything. Mucus behaves in a similar way. The problem after 60 is that thirst becomes less reliable. Many older adults do not feel thirsty until they are already behind on fluids. Some avoid drinking because they do not want to use the bathroom often. Some take water pills. Some drink mostly tea or coffee and very little plain water. So they may not feel dehydrated, but their throat feels it. Their mucus gets thick. They clear their throat more. They wake up dry. Their voice feels rough. A simple habit can help. Drink water earlier in the day, not only at night. Keep a glass near the bed. Drink warm water in the morning before coffee. Add soups, herbal teas, cucumbers, oranges, and other water-rich foods. But if you have heart failure, kidney disease, or have been told to limit fluids, follow your doctor's advice. Do not increase fluids without checking. For everyone else, consistent hydration can make mucus easier to clear. The fifth cause is gut irritation and diet. This one is less obvious, but it matters. The gut and the airways are connected through the immune system. When the gut is irritated, inflamed, or out of balance, some people become more reactive in the nose, throat, and lungs. This does not mean every throat problem starts in the gut, but for some older adults, a low-fiber diet, frequent antibiotics, high sugar intake, heavy processed foods, and chronic stress can affect the gut in ways that also affect inflammation in the airways. That may make mucus problems worse. The solution is not complicated. Add more fiber gradually. Eat more vegetables, beans, oats, lentils, apples, and seeds if you tolerate them. Add fermented foods if they agree with your stomach, such as plain yogurt with live cultures or kefir. Cut back on heavy late-night meals, sugary snacks, and highly processed foods. This supports digestion, reflux control, blood sugar, and inflammation at the same time. Now, before I give you a simple action plan, I need to mention warning signs. Most throat mucus is not dangerous, but some symptoms should not be ignored. Call your doctor if you have blood in the mucus, trouble swallowing that is getting worse, unexplained weight loss, a lump in the neck, pain that does not improve, fever that keeps returning, shortness of breath, or a voice change lasting more than a few weeks. Do not try to solve those symptoms with home remedies. Those need medical attention. Now, here is the simple plan I would start with. First, stop eating 3 hours before bed for 2 weeks. This helps you test whether silent reflux is part of the problem. Second, drink warm water in the morning before coffee or breakfast. Give your throat moisture before the day starts. Third, try a daily saline nasal rinse for 1 to 2 weeks if you feel drainage, post-nasal drip, allergies, or sinus irritation. Fourth, review your medications with your doctor or pharmacist, especially blood pressure pills. Ask whether any could be causing cough, throat irritation, or mucus symptoms. Fifth, improve your hydration during the day. Do not wait until you feel thirsty. Sixth, support your gut with more fiber and simple whole foods. And most importantly, track the pattern. Is it worse in the morning? Worse after meals? Worse when lying down? Worse in dusty rooms? Worse after starting a medicine? Worse with certain foods? Patterns point to causes, and causes point to solutions. Let me bring this together. Constant throat mucus after 60 is not usually random. It may be silent reflux coming from below. It may be post-nasal drip coming from above. It may be a medicine irritating the throat. It may be dehydration making mucus thick and sticky. It may be diet and gut inflammation making the airways more reactive. And very often, it is not just one of these. It is 2 or 3 working together. That is why one lozenge does not fix it. That is why drinking water once does not fix it. That is why cough syrup may not solve the real problem. The goal is to listen to the pattern, reduce the triggers, and support the body's natural clearing system. Before you leave, think about your own throat. Is it worse in the morning or all day? Do you clear your throat after eating? Do you feel drainage from the nose? Did it start after a new medication? Does your mouth feel dry? Write those answers down. Then bring them to your doctor if the problem keeps going. You do not have to accept constant throat clearing as just another part of aging. Your body is giving you a signal, and once you understand the signal, you can respond more wisely. I am Dr. James Walker. Take care of your throat, protect your breathing, and remember this: mucus is not the enemy, it is the message.